Myocardial infarction, heart attack. Introduction. 1. Myocardial infarction, MI, is a serious medical condition that occurs when there is a sudden loss of blood flow to a part of the heart muscle, leading to tissue damage and potentially life-threatening consequences. Causes. 1. The most common cause of myocardial infarction is the formation of a blood clot, thrombus, in one of the coronary arteries, which supply oxygen and nutrients to the heart muscle. 2. The clot usually develops at the site of atherosclerosis, where fatty deposits, plaque, build up within the arterial walls, narrowing the arteries and reducing blood flow. Risk factors. 1. Several risk factors increase the likelihood of experiencing a heart attack. 1. These include age. Risk increases with age, especially over 45 for men and 55 for women. Family history of heart disease. Smoking. High blood pressure, hypertension. High cholesterol levels, hyperlipidemia. Sedentary lifestyle. Obesity and overweight. Diabetes. Stress. Excessive alcohol consumption. Illicit drug use, for example, cocaine. Pathophysiology of myocardial infarction heart attack. Atherosclerosis. 1. Myocardial infarction typically results from atherosclerosis, a condition characterized by the buildup of fatty deposits, plaque, in the inner lining of coronary arteries. 1. These arteries supply oxygen-rich blood to the heart muscle. 2. Atherosclerosis progresses over time and can lead to the narrowing and hardening of the arterial walls, reducing blood flow to the heart. Formation of coronary artery plaque. 1. Atherosclerosis begins with damage to the arterial endothelium, inner layer of blood vessels, due to various factors such as smoking, high blood pressure, high cholesterol, and inflammation. 2. The damaged endothelium attracts circulating immune cells and lipoproteins, including low-density lipoprotein, LDL, cholesterol. 3. These lipoproteins accumulate in the damaged area, leading to the formation of fatty streaks and plaques. Development of vulnerable plaques. 1. Not all plaques are equal, some are more stable, while others are vulnerable to rupture. 2. Vulnerable plaques have a thin fibrous cap covering a lipid-rich core. 2. The fibrous cap can become weakened due to inflammation and other factors. Plaque rupture and thrombosis. 1. In some cases, a vulnerable plaque can rupture or fissure, exposing the underlying lipid core to the bloodstream. 2. When the plaque ruptures, the body perceives it as an injury and initiates a blood clotting process to seal the exposed area. 3. Platelets aggregate at the site of rupture and form a blood clot, thrombus, on top of the plaque, further obstructing blood flow. Acute coronary syndrome, ACS. 1. Myocardial infarction is part of a spectrum of diseases known as acute coronary syndrome. 2. Unstable angina and non-ST segment elevation myocardial infarction, NSTEMI, occur when a thrombus partially obstructs the coronary artery, leading to temporary or partial ischemia, reduced blood flow, to the heart muscle. 3. ST segment elevation myocardial infarction, STEMI, occurs when a thrombus completely blocks the coronary artery, resulting in prolonged ischemia and irreversible damage to the heart muscle. Myocardial ischemia and cell death. 1. With reduced blood flow, ischemia, the heart muscle does not receive enough oxygen and nutrients to function properly. 2. As a result, the affected cardiac cells undergo anaerobic metabolism, leading to the accumulation of lactic acid and further damage to the cells. 3. If blood flow is not restored promptly, irreversible cell death, necrosis, occurs within the affected region of the heart, leading to a myocardial infarction. Inflammatory response and scar formation. 1. Following the initial injury and cell death, an inflammatory response is triggered, involving immune cells and cytokines. 2. Over time, the dead tissue is replaced by scar tissue, which does not contract or contribute to the heart's pumping function. 3. The formation of scar tissue may lead to complications such as heart failure and arrhythmias. Symptoms. 1. The common symptoms of a heart attack include chest pain or discomfort, often described as pressure, squeezing, or heaviness, that may radiate to the arm, back, neck, jaw, or shoulder. Shortness of breath. Nausea or vomiting. Cold sweat. Fatigue and weakness. Lightheadedness or fainting. 2. It's important to note that not everyone experiences the same symptoms, and some individuals, especially women, May have atypical symptoms like abdominal pain or fatigue. Diagnosis. 1. The diagnosis of a heart attack involves a combination of patient history, physical examination, and various diagnostic tests, including electrocardiogram, ECG/EKG, to measure the heart's electrical activity. Blood tests, for example, troponin levels, to detect cardiac enzymes released during heart muscle damage. Imaging tests, for example, echocardiogram, angiography, to visualize the heart structure and blood vessels. Treatment. 1. Time is of the essence during a heart attack, so seeking immediate medical attention is crucial. 2. Emergency treatment may involve administering medications like aspirin and thrombolytics to dissolve the clot and restore blood flow. 3. Coronary angioplasty and stent placement may be performed to open narrowed arteries and keep them open. 4. Cardiac rehabilitation and lifestyle changes are essential for recovery and reducing the risk of future heart problems. Prevention. 1. Preventive measures can significantly reduce the risk of heart attacks. Adopting a heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins. Regular exercise and maintaining a healthy weight. Avoiding smoking and limiting alcohol consumption. Managing chronic conditions like hypertension, diabetes, and high cholesterol under medical supervision. Complications. 1. A heart attack can lead to various complications, such as heart failure, arrhythmias, and cardiogenic shock, a severe condition where the heart cannot pump enough blood to meet the body's needs. Conclusion. 1. Myocardial infarction is a serious and potentially life-threatening condition that requires immediate medical attention. 1. Timely diagnosis, appropriate treatment, and lifestyle changes can significantly improve outcomes and prevent future occurrences. Remember, if you or someone you know experiences symptoms suggestive of a heart attack, call emergency services immediately. Early intervention can save lives and prevent further damage to the heart muscle.